there'll be a bit of swelling, and that'll make it feel even bigger, but softer. Most guys find that by the time it settles down after a few weeks, it basically feels normal. The hyaluronic acid is a soft gel, and for some guys who get a lot of product in, they say that it does feel a little bit softer when the penis is flaccid, although for most people a soft penis is soft anyway. When it's erect, generally it's so full of blood and the skin is tight that basically it feels normal. I'd say maybe 10-15% of guys have said that, yeah, it feels just that little bit spongy for the outside millimeter or so when it's erect. Most guys just don't notice. The interesting thing is that, in fact, it's the same as all cosmetic surgery. It's about feeling comfortable and confident in your body. And this is a special area for guys, obviously. And it can be a locker room thing, and just that feeling of being compared and other guys who might comment or judge or think something about the size of your penis. And so a lot of guys are saying, yeah, I just feel more confident generally, I feel more confident in the locker room. Guys have sort of said just in general and in business, it's not something that's in the back of my mind now, I feel confident. And then also sexually, initially I didn't think that partners were going to notice that difference in girth, but we routinely get 1 inch increase in girth. So guys will commonly go from 9.5 centimeters, which is the average flaccid circumference of a penis, up to 12 centimeters, which is now like at the 90th, 95th percentile. And so yeah, partners notice the difference as well. Yeah, it's an interesting area because all cosmetic surgery is unnecessary, and I go through this conversation with people commonly saying, you don't need to have this, and it's surgery. Somebody died from having cosmetic surgery just a couple of weeks ago, but is there any reason why the penis should be anything special? Certainly in the articles that are in the psychology journals, you'd feel like the penis is like special and given to you by God, and nobody should touch it except for your life partner or something. And I'm not so sure. Maybe it's just another piece of tissue. It has special connotations, and that's for sure. And that's why our first 2 papers that we've written on this have been written with a PhD psychologist who has a special interest in cosmetic surgery of the genitalia. And that's been really interesting working with her and giving us a really good insight into the reasons why people are doing this. We have always considered giving everybody a questionnaire right at the start, but it's one of those questionnaires which sort of sounds like, are you a little bit crazy to want to do this? And I just wonder if that's a bit discriminatory. So yes, it's a special area. It does have special significance, but in a lot of other ways, it's just cosmetic surgery, the same as any other cosmetic surgery.